Hello everyone, my name is Saroj Bhangade. Today date is the 8th February 2022. Today video topic is the United States of America and European Medicine Agency law. The first is the United States of America. The headquarters of US FDA are located in the Maryland in United States. It has offices located as a multiple international site, including the India. The law of Food, Drug and Cosmetic Act, the Federal Food, Drug and Cosmetic Act in 1938. The Food, Drug and Cosmetic Act is a federal law enacted by the U.S. Congress. The Food, Drug and Cosmetic Act can be found in the United States Code, which is which contain all general and permanent law beginning at 21 USC 301. This particularly act was passed by the U.S. Congress in 1938 following the sulfonamide disaster. The first is the demand evidence. Of safety and new drug prior to granted market. Second is the issue standard for food, and third is the conduct the factory inspection. The Kafler-Harris amended of 1962. The pharmaceutical company required to prove the effectiveness of the medicinal product before the launch into market, and also report the side effect and post-marketing surveillance. Second is the evidence of effectiveness was based on the well-designed clinical studies. Studies required to give them the informed consent. It gave the 180 days to approve the new drug application industry, and mandatory periodic inspection of the production facility. The regulation. The FDA authorized to create the regulation. Regulation are rule issued by the FDA under the power of law. The FDA published the proposed version of the newly created amended and version of the regulation in the Federal Register public consultation. Subsequently, the public consultation and internal FDA review final regulation then published in a Code of Federal Regulation. Code of Federal Regulation. It is the first codification of the rules and regulation published in a Federal Register by the federal government of USA. There are considered as a binding in a court of law. The Code of Federal Regulation divided into the 15 titles. Each title consists of the chapter, subchapter, part and section. Each title is revised in once every calendar year. The annual update cycle of the various title as follow. Title 1 to 16 update on the 1st January. Second is the title 17 to 27 updated on the 1st April, and title 28 to 41 update on the July 1st, and title 42 to 50 update on the 1st of October. Of this 15 title, the title 21 govern the title 21 govern the rules of the Food and Drug Administration. The title 21 divided into the 3 chapter. First chapter is FDA based upon the Federal Food, Drug, Cosmetic Act. Chapter 2 is the Drug Enforcement Agency. Chapter 3 is the ONDP, Office of National Drug Control Policy. The regulation pertaining to pharmacovigilance are follows. Title 21 Code of Federal Regulations, Section 301 and 305 is a prescribed drug market for human use without the approved application. Second is the Title 21 Code of Federal Regulation 314 Section 31480 Human Drug Approve NDA. Title 21 Code of Federal Regulation Section 321 32 the Investigation New Drug Investigation New Drug Safety Report. The Title 21 Code of Federal Regulation 31498 Human Drug Approve ANDA abbreviative New Drug Application. Title 21 Code of Federal Regulation 600 Section 680 Human Biological Product approved by the BLA. The Title 21 C Code of Federal Regulation Section 681 Human Biological Product with the approved BLA. Second is the European Medicine Agency. There are 27 member of European Union, and European Medicine Agency is the centralized body for regulation. The function of the EMA is as followed. First is the marketing authorization, second is the safety monitoring medicine, third is the refer, fourth is the inspection, fifth is the telematic, and sixth is the stimulating investigation. The operation of the EMA is started in 1995. In July 2012. New pharmacovigilance region become applicable in the European Union to support the implementation of their new legally set of guideline good pharmacovigilance practices world developed and adopted. The legal framework this replaced the previous set of the guideline in volume 9A. The legal framework for pharmacovigilance medicinal product for human use in European Union is given the regulation EC 27 by 2004. This regulation now replaced in the European Union 2135 by 2010 and Directive 2001 by 83 by EC and Directive 2001/82 by EC of the Community Code relating to the medicinal product for the human use. This is the United States of America law and European Medicine Agency of law. Thank you.